Spleen. The spleen is an organ found in virtually all vertebrate animals. Similar in structure to a large lymph node, it acts primarily as a blood filter. The spleen plays important roles in regard to red blood cells and the immune system. It removes all red blood cells and holds a reserve of blood, which can be valuable in case of hemorrhagic shock, and also recycles iron. Hematological diseases. Hematological diseases are disorders which primarily affect the blood. They are myeloid and hematological malignancies. The myeloid diseases are hemoglobinopathies, anemias, decreased numbers of cells, myeloproliferative disorders, and coagulopathies. And the hematological malignancies are lymphomas, plasmacytoma, and leukemias. Splenectomy. A splenectomy is a surgery to remove the entire spleen, a delicate first-side organ that sits under the left rib cage near the stomach. If only part of the spleen is removed, the procedure is called a partial splenectomy. Open splenectomy. Open splenectomy requires a larger surgical cut than the laparoscopic method. The surgeon makes a cut across the middle or left side of your abdomen underneath the rib cage. After location the spleen, the surgeon disconnects from the pancreas and the body blood supply and thus remove it. The surgical openings are closed using stitches or sutures. During spleen removal, the surgeon will also check for extra spleens. About 50% of patients have more than one spleen. The extra spleen may need to be removed in such patients. Laparoscopic splenectomy. Laparoscopic splenectomy is done using an instrument called a laparoscope. This is a slender tool with a light and camera on the end. The surgeon makes 3 or 4 small cuts in your abdomen and inserts the laparoscope through one of them. This allows the doctor to look into the abdominal area and locate your spleen. Different medical instruments are passed through the other openings. Of them is used to deliver carbon dioxide gas into your abdominal area, which pushes nearly organs out of the way and gives your surgeon more room to work. The surgeon disconnects the spleen from surrounding structures and the body's blood supply, and then removes it through the large surgical opening. The surgical openings are closed using stitches or sutures. Complication. Splenectomy is generally a safe procedure, but as with any surgery, splenectomy carries the potential risks of complications. The potential complications include bleeding, blood clots, infection, injury to the other organs, nerve including your stomach, pancreas, and colon. Side effects. A splenectomy causes an increased risk of sepsis due to the encapsulated organisms. The patient should receive the pneumococcal conjugate vaccine, HIV vaccine, and the meningococcal vaccine, C. asplenia. These bacteria often cause a short throat under normal circumstances, but after splenectomy, when infecting bacteria cannot be adequately diagnosed, the infection becomes more severe. Partial splenectomy. Much of the spleen's protective roles can be maintained if a small amount of spleen can be left behind. Where clinically appropriate, attempts are now often made to perform either surgical subtotal or partial splenectomy or partial splenic embolization. In particular, virus vaccination and antibiotics provide good protection against the risks of splenia. This is not always available in imported countries. However, as it may take some time for the preserved splenic tissue to provide the full protection, it has been advised that preoperative vaccination is still be given.